New York University is a unique institution, a leading private university, but its mission and its dedication is to public welfare, public education, and public health. So we are a private university in the public service. NYU has an exceptionally large, complex, and diverse department. It consists of a total of 8 affiliated hospitals, 2 very large flagship city hospitals, the historic Bellevue and Woodhull in Brooklyn, 2 of the largest VA hospitals in the country, the Manhattan and Brooklyn VAs, which combined together take care of the health and mental health needs of 10,000 returning Iraq and Afghanistan veterans, 3 state hospitals, that's 25,000 psychiatric hospitalizations a year, and well over 300,000 outpatient visits a year.
Bellevue is the oldest public hospital continuously operating in the United States. It has developed into a general hospital that serves anyone who walks in its front doors. So we have 850 beds here, 360 of which serve people with psychiatric and substance abuse disorders. The psychiatry department, it truly is a place where no one is turned away. Our philosophy is to make sure that everyone whom we treat receives the best possible care, that based on the best science of the day, with compassion and devotion to the patient's interest. We have the capability of working with people who speak up to 200 languages, and we do that on a routine basis.
Bellevue Hospital has enormous resources in terms of diversity of patients, great clinical training, and it's a wonderful place for recruitment of research subjects. New York has just the ideal combination of very strong neuroscience, much of which is shared between some of the top programs here. The Druckenmiller family recently gave a gift of $100 million to establish a neurosciences center, and this is to extend what was already a very strong neuroscience program. They are now recruiting international leaders in neuroscience and building what will be a very strong translational neuroscience program. That's in addition to the traditional partnership with the Nathan Kline Institute for Psychiatric Research, plus a very rich clinical base at Bellevue Hospital. The end goal is not only will NYU have one of the strongest pure neuroscience programs in the country, NYU is building translational research, clinical programs that all will closely integrate with that program. So I think it places NYU in really a unique position to be a leader in translational neuroscience.
NYU was the first place, along with Bellevue, to foster a new understanding of the developmental needs of children and to begin a translational approach to medicine, where animal models were used to understand diseases. It's now appreciated that serious mental illness is a leading cause of disability in most places in the developed world. And the goal of translational research is to make sure that our benchtop discoveries and our population research on risk pathways can generate information to improve the lives and health of people with a disease. Beyond that, we want to go curbside and be able to prevent serious mental illnesses. The field is looking to better understand intergenerational exposures, gene expression, and even how new mutations may form in humans that contribute to mental illness, lasting several generations and then perhaps disappearing from the population. NYU and Bellevue are poised to understand these new models of intergenerational stress and trauma and their relationship to mental illness.
What we know is that mental illness often starts in childhood. One of our top areas of focus is to develop interventions or other clinical tools that start here but can travel across the city, state, and nation. We have designed ways of looking at clinical services to spot innovations, evaluate, standardize those innovations with a view for where they may go, and organizing our department really to take innovation, measure it, and transfer it.
The department is also committed to public education in the field of psychiatry.
So I'm going to get a pharmacology consult from you
cool.
while we're sitting here.
The doctor radio experience is really, really very special. We're providing state-of-the-art, direct information to the general public. We help them learn how to access care more effectively. We bring them the latest developments in research in all aspects of medicine, including psychiatry.
We train more physicians annually than most departments in the country or worldwide. We train a total of 110 physicians as residents, child fellows, and adult subspecialty fellows. And historically, NYU Bellevue has trained probably more psychiatrists in America than any other facility.
We feel very fortunate at NYU. Our program is so popular that more than half of the students in the United States applying to psychiatric training programs apply to our program here at NYU. It's always really important to give our medical students the best type of experience that we possibly can. And one of the things that's really terrific here is that our clerkship has been the highest rated clerkship of all the clerkships in the medical school for a number of years running. They're really drawn by the diversity of the experience that we have. So we have training experiences in the VA system, in the city system through Bellevue Hospital, in the not-for-profit private system here at Langone Medical Center, and at our state facilities, Manhattan and Rockland Psychiatric Center. So they can really learn to take care of patients in every part of the healthcare system in the United States.